Health and Social Services, their spokesperson, Janela Carrera. Good morning, ladies.
Good morning.
Hi. Good morning.
I guess we'll just start with Thanksgiving because that's kind of what's on everybody's mind. So we saw the new guidance coming out. There was just one question I had, and I guess we could start there. So Thanksgiving gatherings are limited to 5 people, period. Is that what we're saying? Because I know that there's an allowance here for people outside of your household, but I just wasn't clear on what's the total number of people who can be at a Thanksgiving gathering. And then we'll just go from there, I guess.
So to clarify that question, Chris, the safest way to celebrate Thanksgiving this year is to celebrate with those within your household. So if you have a household of, let's say your family, right? So how many kids? 5 kids, yourself, so that's 6 people. So then we're not limiting you to 5 people. But in the event that you do have a household smaller than 5 and you do want to have someone over, your limit, you should really be mindful of it should be 5. Nothing has changed with the governor's executive order. Nothing has changed with the governor's executive order. The social gathering limit remains at 5. A safer at home advisory remains in effect. So again, we ask people to celebrate this Thanksgiving by spreading love, spreading thanks, but not spreading COVID. So celebrate within your household. And that's the ideal situation. We really we encourage families to, if they have larger families, to celebrate via Zoom, to maybe drop dishes to one another in a safe way. But, again, safer at home advisory remains in effect. Please try to celebrate as much as you can with those within your household. If you do have a smaller household, maybe you live alone, or maybe it's just you and your partner and you want to have 3 others over, then you can. But we also encourage you to eat outdoors. Again, that's also in effect. Outdoor dining is allowed through this executive order, through the current public health guidance. But again, wear your mask, social distance. And we also encourage you to, limit that foot traffic into the kitchen, maybe assign someone to dish out the food the way we do at the buffets. We just have so much we've learned about COVID-19, and a lot of the stories we're hearing is that it's spread when people are eating. That's when you let your guard down, when you let your mask down. I did interview a police officer who caught it while he was eating with his coworker. And so when we put down our mask, we put down our guard, and COVID can still spread that way. So we encourage you stay within your household.
Janela?
The other thing too is, a lot of times we don't realize that, especially during the asymptomatic phase of the virus, is when we're probably the most highly, the virus spreads the most. So you could be asymptomatic and have the virus and be spreading it. So you may feel fine and you go and visit, your friends, your family, especially during Thanksgiving, which is when people really do want to visit, their grandmother, their mother, their family members. But you may not realize you could be spreading the virus. So it's really important, to try to stay within your household, those that you frequently see, frequently spend time with. And like Crystal mentioned, if your family size is 8, those are the people that you live with, then of course we're not limiting that. We're not telling you to kick out your husband, your wife, just because the limit is 5. But if there's only 3 of you and you want to invite 2 people over, that's fine. But try to keep the social distancing. Use plastic cups, plastic spoons, disposable plates, and limit, the interaction, the contact with one another.
Again, and also by the nature of Thanksgiving, what are you doing? You're feasting. You're probably staying at around the table, hanging out around the table with your mask off, indulging in food. And so what we've heard from contact investigators is that many of the cases that they've spoken to, many of the individuals that have caught COVID, they caught it while they were sharing a meal. They caught it while they were sharing a drink. They caught it while they were sharing a vape. That was one unique story I heard. And so Thanksgiving is especially vulnerable. The governor, in her meeting with the Rotary Club last week, she mentioned in Canada, they celebrate Thanksgiving in October. Their Thanksgiving is a little different, but same concept, that they're around a table and they're feasting. And so what they saw was the incidence of cases. There was a spike the 2 weeks following Thanksgiving. We don't want to undo the progress that we've already made. As you're seeing, the numbers are slowly starting to decline. Again, we want Christmas. Christmas is, there's a light at the end of the tunnel. The end of the year, we're seeing the CAR score decrease. We're seeing hospitalization start to go on the decline. And so let's not undo that progress. Let's stay the course. And that's why Thanksgiving, it's so important that we stay within our households. You can't stress that enough.
Janela, this lady, so these, under the guidance that you put out on there's a graphic sheet here, hosting a Thanksgiving gathering. If having guests to your home, be sure that people follow the steps that everyone can take to make Thanksgiving safer. Other steps you can take include have a small outdoor meal with no more than 5 people who do not live in your household. Have conversations with guests ahead of time to set expectations for celebrating together. Clean and disinfect frequently. Touch surfaces and items between use. If celebrating indoors, make sure to open windows and bring in fresh air. These attending a gathering, bring your own food, drinks, plates, cups, and utensils. I kind of had to laugh at that one. Sorry, it's a crazy world we're living in here. So people who are, if you live in the same household, then I guess you could use the same utensils and dishes. But if you're a guest at a gathering that's limited to no more than 5, unless you have a household over 5, then you have to bring your utensils, your own plate, maybe not even throwaways, to be environmentally conscious. You could bring your stuff and maybe write your name on it, right? I don't know. Does that advise?
Sure. Right. Yeah. Bring your own BYOP.
Paper
bring
products.
Your own plates. Bring your own paper products, or, like you mentioned, disposable ones. If you don't, but if you want to be environmentally conscious, then, bring your own plates, bring your own spoons, bring your own cups, and write your name on it if you'd like to. Metal, they make those, you can bring your own metal. We had, our own, when I was at the governor's office, we had one co-worker who would bring her own stuff, and they were metal not disposable, but metal containers. So.
What do you make of this? We had a comment here about there are more people allowed at funerals than will be allowed at Thanksgiving gatherings. Maybe, I don't know, explain the logic between why we can only gather at 5, but at funerals you could have up to, what is it, I think 25 or something? I think it was.
10.
10, okay.
10.
So
at a funeral?
Yeah.
Limit is 10. Well, I think when you're looking at a funeral, you're not sitting around at a table, you're not removing your masks, you're not eating, there's not conversations going on. There are restrictions in place at a funeral. For the most part, you're viewing, you're not going up close to, the deceased. So there are restrictions in place at a funeral. There's very limited conversation happening, and for the most part, you're keeping your mask on. During Thanksgiving, go ahead.
Also, at funerals, we're prohibiting the serving of food. So what happens usually after the funeral, you go outside and they have a meal prepared for you. We're not allowing that, and so again, we know we're most vulnerable when we're eating. And so that's also another difference. Funerals are a really limited amount of time versus Thanksgiving. You're probably going to spend all afternoon hanging out together with your family. And so we want you to think about your nana, your papa, thinking about how vulnerable they are, especially to COVID, since they're probably doing their best. They're probably doing a great job at staying home, but it's us who are mobile, who are going to work and are coming home that are possibly, sharing COVID.
Is the reason why this guidance was issued because there's sort of this acknowledgement that it is Thanksgiving and people really aren't going to stick to the executive order prohibiting the congregation and the social gatherings where it's just limited to your household? Is this just like just in case this is what you should do if you don't plan on following the executive order? Because it kind of just goes back to kind of like this mixed messaging.
Right. So the Thanksgiving guidelines really are, the Guam one really mirrors the U.S. Centers for Disease Control and Prevention one. And so this is the best practices. This is what we know works. This is what we really recommend to the community. A similar incident with Halloween. You know, we really ask the community to change their behavior, because we're so used to celebrating a certain way, but 2020 is we have to change our behavior. Everything is different. Hopefully when life starts to go back to normal, we can return to the way we used to celebrate, but holidays are especially hard. And so we put out these guidelines so people know what the best practices are, and they can continue to do their part to stop the spread of COVID-19.
You know, you talked about the CDC, and then earlier you had referenced that the CAR score continues to decline. Could you maybe explain a little bit for our viewers how our CAR score can be declining, but the Centers for Disease Control has actually increased the risk assessment for Guam? We're now level 4, which is the highest level you can be, high risk for travel. They're advising everyone to avoid travel to Guam. So, I mean, if you could just clarify, how is it that our number that we have here locally is continuing to look better and better when, in the CDC's eyes, Guam is out of control hotspot?
So maybe we should just go back and define CARS score for some of our viewers at home. Again, the CARS score stands for COVID Area Risk Score. It's a tool developed by our local physicians, you know, really authored by Dr. Felix Cabrera, to help us determine our COVID risk. So it takes into account the incidence of new cases, how well our testing identifies these new cases, and as well as the rate of spread. And so this score helps us to determine our COVID risk. Basically, the lower the score, the better our ability locally to manage our COVID risk, and the higher the score, the more we are testing those maximum limits of our public health system and our hospitals. So what you saw a few weeks ago when our CARS score was in the 40s was we were putting out we had to do extraordinary measures to help manage our COVID response. You know, the Blue Med tents had to be assembled. We've had to, you know, call on our military counterparts to help supplement or augment our staffing in the hospital. We have the New West nurses that are helping us. And so the lower the score, the better we're able to manage. You know, locally, we're able to manage, we're not testing our limits. Public health and GMH and GRMC and Naval Hospital are able to manage, you know, their workload as well. And so in response to the CDC considering us a high risk, I think that's a fair assessment, as we still have, now we have over 6,000 cases. So in the long term, you know, we still are at high risk, but until we really get down to that ideal, that strive for 5 and below, then I think they would reassess and possibly lower that designation.
Janela, can we go back to just the funeral thing? This is kind of just on so Saturday night I came through the St. Augustine funeral home. I went through that way, and man, I don't know if can you maybe clarify the guidance, because it was a lot of people, definitely more than 10. So is it 10 at a time, or can 200 people show up to a viewing and they're all going to be able to see the body? Because I mean, just outside looking in, when you drive by, you see that kind of thing, and you know what the guidance is. You're kind of like, oh my God. And the funerals have been, according to you guys, spreader events in the past. So can you just clarify what exactly is the protocol for viewings? I guess that would be a viewing, since it was at St. Augustine Funeral Home. It was packed, man.
So, yeah. So based on my understanding of the way the funeral homes have been allowing for the viewing aspect of the funeral itself, so it's typically 10 at a time. So what they'll allow families to do is, when one person goes in and is finished with viewing the person, the deceased, and they're done, they exit, and they'll allow another family member to go in and view. And so it's kind of like on a rotation. They'll allow that to occur. And so what they'll do is they'll allow other family members to wait outside. And I'm hoping they're socially distancing while they're waiting outdoors. We have received complaints in the past when there's crowds outside, people waiting, and it appears as though it's a large funeral occurring. And when we do receive those complaints, we do go out and we inspect or we'll observe to make sure that, they're not violating the limitation of the funeral guidance. But so far, when we go out and we inspect or we observe, for the most part, they've been compliant with the 10 limit rules. So funeral homes have been, actually, they themselves monitor and they ensure compliance. So they've been pretty good about ensuring that the guidelines are being followed.
Can we get since we have you both on here, just a recap of the rapid employment team, or rapid engagement team deployment yesterday?
Sure. Yeah. So we had a pretty successful run yesterday. Out of the 139 specimens that were collected, we had 13 positive. So 126 were negative, 13 were positive. We were out in 3 apartment complexes in NCS, and then 1 little neighborhood in the subdivision of PIGA in Dedido. I don't think we really had very many issues. I think the only real concern that we had was that, when we did our scouting and preparation weeks in advance, we passed out flyers, we worked with the property managers, we worked with the mayor's office to identify the homes and the apartment complexes that we wanted to visit and offer the testing to. And, the residents, we wanted to prepare them so that they're aware that on Sunday we would be there and do the testing. But when we got there, there were a lot of residents that weren't home or just, simply refused testing. Wow. So that's why you're kind of seeing the low numbers, 139 total. We were prepared to do about 200 tests, but we only did 139.
Janela,
and even then,
how was PIGA and NCS and these apartment complexes selected for this RET testing?
So when we, after we completed the Gilbaza and zeroed down rapid engagement team and mobilization, we regrouped and we talked about what our next, possible rapid engagement team site would be. And these areas, along with other areas we looked at, had multiple positive cases. And through contact tracing, we saw that there were other positive cases popping up in these areas. These were high-risk hotspot areas for COVID-19. And so we saw that, this was one of those areas we wanted to target. We worked with the mayor's office. We worked with the FSM consulate office. And so this was those that we thought, we need to go in. We wanted to do active case finding. And so that's how this was chosen. But of course, this is not the only area we're going to be targeting. There are other areas we want to look at as well.
Right. I wanted to ask, because I think it's these drivers would be working with the rapid engagement team, right? So in hiring these EMTs, I know that there were some of the qualifications that would be in place maybe pre-pandemic or being waived, like the chauffeur's license or requirement. Could you kind of explain the need for that waiver, Janela, and how it relates to I guess the need for these drivers?
Sure. So what we're doing now, so we're in the process of trying to bring on board 10 EMTs. And so the reason why we're trying to waive the chauffeur's license is because we're not actually going to have them drive ambulances or fire trucks. What we really need them for is nursing support. So for example, we have a community outreach or another rapid engagement team mobilization. The EMTs will be there in the event that there is emergency care needed or life support care needed. We don't have emergency vehicles. DPHSS doesn't have emergency vehicles for them to be able to do, whether it's ambulatory or non-ambulatory support or driving. So really there's no need for them to have need a chauffeur's license. We don't have emergency vehicles for them to drive. And so we sought, that waiver to see if that's something that can be done, because we do really need them on board. Now, if there is a need for them to be transported right away to the hospital for life-saving care, then we would just call 911 or call GFD for transport. But to have somebody on site, using AED device, then we would have an EMT there to be able to offer that kind of support.
Would they get paid the same as the EMTs who are qualified?
So the pay, that as far as how much they'll get paid, that's something that's being handled through DOA. So that's probably something I would defer to DOA to handle, because it's being budgeted through CARES Act. So that's all being handled through DOA, and so I think that's all being worked out right now. They're actually not officially hired yet. The paperwork is still being processed.
So they would just strictly serve in this rapid engagement team deployment, and is there any way that they could be hired as EMTs, and then once they're hired, oh, we're EMTs, we're going to go over to GFD, or we're going to start driving the ambulance? Are there any safeguards in place?
Yeah, so that's the goal, right? That's the goal eventually, because we foresee that we'll need them in the long run. COVID is probably not going to go away for a while, and we're hiring them through CARES Act funding, but eventually, and they're fresh graduates. For I think most of them, this will probably be their first real EMT job. But in the long run, we eventually want to bring them on board through GFD, working as EMTs with the Guam Fire Department.
But they would have to go
we'll
get
eventually work with Guam Fire.
I see.
Right. Eventually, we'll work with Guam Fire to get them their national certification. So, and that's in the long run.
So they have to go through the academy and all that stuff that firefighters go through.
So while they're with us, we'll work on getting them that as well. We'll work with GFD to get them the national certification, so that by the time they're ready to transition, hopefully they'll have all of that under their belt, and once they're ready to transition, they can just move on to Guam Fire Department.
Janela, I wanted to share this message I got on WhatsApp yesterday. Mr. Barnett, happy Sunday. I was able to get a COVID test by public health. Please fan pray I'm negative. But if you can give a shout out to those awesome nurses, assistants, and public health employees that were deep in Isang Song Derito in the hot sun, under the canopy and clothed in MIPE-looking medical garb and scrubs on a Sunday. Even Mayor Savares and Jolene Almandres seem to be facilitating beautifully the COVID testing. I don't know these people well, and despite all the tough news and negativity in this day and age, it is comforting seeing amazing people like that give up their Sundays. Biba Guam.
Can we get an update on?
Thank you so much.
Can we get an update on the fines and fees? Are we close, or we're still? It's under legal review.
On the which?
The implementation of the fines and fees.
Okay, so public health, as you know, had the two public hearings. Public health ultimately took into consideration those comments that were made during the two public hearings, and they were adopted last week. But right now, we can't actually enforce those fines until a formal process is established for individuals and for businesses to challenge those citations issued to them. So right now we're formalizing that process. We hope to have good news in the next week or so that we can make sure we have some muscle in our enforcement. And I understand that it's going to be a process that's familiar to us. It's going to be similar to what the goal is, to make it something similar to a speeding ticket. You either pay your speeding ticket or you challenge it in the traffic court. And so that's the process. Unfortunately, we can't enforce it just yet. We hope to do so shortly. And so, as we progress into our COVID response, we're really able to keep those numbers low.
Are you guys disappointed at all that you weren't able to have this valuable enforcement tool before Thanksgiving?
Yes,
we're
but
just
we had to go through the process, and I think there was valuable input we received during the public process.
Okay.
I think we're just, you know, we're going through the process, and you know, we'll just let it ride out. So we'll wait for it to officially go through. We want to make sure that it's properly vetted before it's, you know, officially adopted.
Right on.
And then the public has the due process. You know, they have their due process that they can challenge citations. It's not just about you getting fined and you having to pay it. You know, we're not there to fine people. We really want to make sure that people have the right to challenge it if necessary.
Janela, can you provide just an update on the move? I know that a lot of the personnel from public health were moving into the ITC building, but we had Annette on weeks ago, and she was also talking about this move to the Hakapatan building for the contact tracers. Is that move still happening, or is everybody just at ITC?
Yeah, no, so there was discussion about the possibility of moving to the Hakapatan building, but that's been put on hold. And so right now it's just kind of at a standstill. And the reason for that is I think we were just wanting to make sure that there was a proper procurement process to go through with that. So that's been put on hold. And it's just kind of sitting there. There's really been no discussion since. But we are, you know, still talking about the possibility of moving the contact tracing and other divisions, actually, including isolation and quarantine, those divisions as well, into other buildings or other office space. Because, you know, as I mentioned, we don't have a permanent home, and we do need space. So, and as Dr. Ann had mentioned, they moved to ITC. So they moved last week, and they're actually still in the process of moving. So we're still looking for other office space. Hakapatan was on the table. I'm not sure if that's still on the table. So other locations, we're scouting for other locations right now.
Has the move been completed? Has the move been completed?
For the EPI
For the
team,
lab, yeah.
I'm not sure. I know that last week they were really busy just trying to move all their space. They have a lot of stuff to move. I would be surprised if they got everything done by last week. I think they're still probably in the process of moving.
Is there any update that public health can provide regarding the construction clusters?
Oh, yes, actually, I just received the update this morning. Give me 1 second, let me pull it up. So as of this morning, we have a total of, 1 second. So last week I reported there were 248 approvals. As of this morning, we have 285 that were approved.
Anybody not approved?
So, you know, for the most part, when we have, so those who get denied, a lot of times it's just a matter of missing documentation. Like, for example, they didn't submit their organization specific plan. So they'll get the initial disapproval, and it's really just a matter of submitting additional documentation, and then it becomes pending, and then they'll get approved later. So they'll get denied at first, then they'll just, you know, they'll clear up whatever is necessary, and then they'll get approved later.
Man, that's crazy. So almost 300 contractors have been approved to resume. Is there any spot checking on you guys? I mean, who does that? Or do you just take the plan, take their word for it, or any public health people go out and make sure that, okay, you sent us this plan, okay, are you following it? Yeah, all right. Or no, you're not.
So if you look at the checklist, there are minimum requirements to meet, right? So for example, if you had any type of work or any type of subcontracts with Cortec or with Black Construction, then of course they'll have to look into that more. But if you didn't, which a lot of the construction companies, I mean, there are tons of contractors here in Guam that haven't done business with either Cortec or Black Construction. So those are probably primarily the ones you're seeing on the list. So there's that. And then we just want to make sure that all of them have submitted an organization-specific plan. So those are primarily the minimum requirements. If you don't have barracks, if you don't have H2 workers, then you meet those minimum requirements, you'll likely get approved.
Okay. And just real quickly, Crystal, so the governor has seen this CDC travel health notice for Guam and raising it to a level 4, the highest level that they have.
I haven't had a chance to speak with her just yet. I'm actually going to 8:30 meeting where I'm pretty sure that will be discussed.
Okay.
Okay. Any inclination,
Hey,
Crystal,
Jane,
for any tightening or easing of restrictions this weekend?
I'm not tracking any changes. As I mentioned, we remain at a safer at home advisory. Again, please celebrate safely with your family, with those within your household. I can't stress that enough. If we see a spike in 2 weeks, and within the next 2 weeks following Thanksgiving, we know that people didn't follow the guidance. Again, these are the best practices. This is what the CDC recommends, and we really hope that the people of Guam, they do their part. You know, we saw after Halloween, we issued the Halloween guidance, that people did a pretty good job. We didn't see too big a spike that may have been attributed to Halloween, so we hope that they continue to stay the course. Again, we might not have a Thanksgiving, but if we continue the course, we get that CAR score and we maintain it 5 and below for a few weeks, then we could possibly have Christmas. So that's the goal. We might have to sacrifice Thanksgiving, but there's potential for Christmas and New Year's. So please stay the course, stay within your household this Thanksgiving, Zoom your dinner, Zoom your lunch. Maybe you can say the blessing over Zoom as well. Call your family. You can exchange meals, but maybe leave it on the porch. Bring your own utensils. I know that sounds weird. You bring your own utensils, bring your own plates, as Janela coined it, BYOP, bring your own plate. So please, happy Thanksgiving to the people of Guam, and just be safe. You know what to do, the 4 W's. Wear your mask, watch your distance, wash your hands, and have the willpower to do it, because we know that we know what to do, but it's actually doing it that might be the challenge, especially as we battle COVID fatigue, right, which is another real challenge as we go into 9 months of this response.
Crystal, can you just provide a little more clarity when you say we could have Christmas? What type of Christmas could we have if we strive for 5?
So when we say you could possibly have Christmas, we could. The governor is looking to increase the social gathering limit. If we maintain that CAR score and keep it below 5, so that is the goal. That is the incentive, positive reinforcement here. So if we are able to really get our act together, really maintain that score, get it below 5, maintain it, then we hope that Christmas we could ease some of the restrictions. And when I'm talking about easing restrictions, it would be specific to social gatherings and that limit. So right now it's 5, but if we continue to perform well, we see this downward trend, then she's inclined to increase that social gathering limit to maybe 10 or more. Because we did enjoy some of that earlier in the summer, where we had the social gathering limit increased.
Thanks, Crystal. Janela, I'm sorry, just before we let you go, just real quickly, do you have anything on the Department of Corrections and the situation over there? I know that they had to retest 100 or so inmates, and we are going to have Joe Carbolito on, but just from public health's side of things, is there anything you can say?
Yeah, so, you know, we are continuing to do the testing at DOC, and there were 62 positive cases there. But, you know, we are working very closely with DOC to, you know, ensure that we test as many inmates and staff as possible, mitigate the spread. We've had our team go out there, including a CDC contingent. We have off-island CDC personnel here, and they're working very closely as well with DOC, trying to look at what other mitigation measures we can offer. I know that we're also working with DOC on their organization's specific plan, just to make sure that it is in line with whatever CDC recommendations there are, because there are specific plans to inmate populations as well. So that's something that we are working on as well with DOC.
I'm sorry, is that 62 new cases out of the 100 that were retested?
Yes, and that was, I believe that was reported yesterday.
Okay. Yeah. What about,
and if I might just add, sorry, go ahead.
Go ahead.
Oh, no. This was, it was unrelated to DOC.
Oh, that's fine. We'll take all the information we can get.
Oh, no, I was just going to tell you, Chris, that message that you read was very heartfelt, and I was just going to ask if you can relay back to that person. Thank you so much on behalf of our team and our nurses. We're anytime we get messages like that, it's really very uplifting. So,
of course, yeah.
Thank you so much.
Of course. You good?
Yeah, I can just follow up with Joe.
Okay.
Thanks,
Thank
ladies.
you, Crystal. Thank you, Janela.
Happy Thanksgiving.
That's a little bit of a reunion here. I like this. Throwback Thursday.
Thank you to our frontliners this Thanksgiving. They've been hard at work for 7 days. No days off for them. So thank you, everyone.
Happy Thanksgiving, ladies. If we don't talk to you again, I figure we will, though, probably. Okay, we'll see you.
Bye.
Bye. It's 8:30. We got to take a break, and we're going behind bars with